I'm now going to perform a foot posture index on this individual using the guide I have here for scoring, and then we'll be looking at their left foot. So the first item is talar head palpation, palpating the talus on either side. It is felt on both sides, but it's felt more medially than laterally. I would score this as a 1. For number 2, looking at the back of the foot, supra and infralateral malleolar curvature. So looking at the curve above and then below the malleolus, the one below is slightly more concave than the one above. And I would score this as a 1. For the third item, looking at calcaneal frontal plane position. So comparing the parallel bottom of the calcaneus to a perpendicular line. This is angled a little bit more inwards relative to this horizontal line, and I would grade this as a 1 which would be between vertical and an estimated 5 degrees of eversion or valgus. For number 4, looking at the inside of the foot. And looking at the bulging in the region of the talonavicular joint. So the navicular tubercle being there. There is some bulging that is present here. And I would mark this as a 2 because it seems to be markedly present. For the 5th item, looking at the height and congruence of the medial longitudinal arch. I would give this a 2. I would give this a 2, meaning the arch is very low with flattening in the central portion. The arch is markedly making contact with the ground. For number 6, going back to the back of the foot and looking at abduction, adduction of the forefoot on the rear foot. So this would be also graded as a 2, seeing that no medial toes are visible from the back viewing angle and only the lateral toes are visible.